and some positives about AIDS. Some reasons for hope with World AIDS Day this weekend, December 1st.
This is Pam Coulter in Washington. 34 million people are living with AIDS and 2.5 million were infected last year alone. But Secretary of State Hillary Clinton believes the scourge can end.
Make no mistake about it, HIV may well be with us into the future, but the disease that it causes need not be.
Clinton unveiled an ambitious 5-point plan to achieve an AIDS-free generation in a matter of years.
Where virtually no children are born with the virus, and as these children become teenagers and adults, they are at a far lower risk of becoming infected than they are today.
The tipping point for a disease that's killed more than 30 million people since the virus was identified in 1981.
As we continue to drive down the number of new infections and drive up the number of people on treatment, eventually we will be able to treat more people than become infected every year.
The Obama administration blueprint is designed to target at-risk groups in a non-threatening way.
We are investing in research to identify the interventions that are most effective for each key population.
Groups that may still feel like hiding in the shadows.
There is still a great sense of stigma. It is still a disease affecting communities that have been historically disenfranchised. The gay community, the African American and Latino communities.
Dr. Michael Horberg is with the HIV Medicine Association, an organization on the front lines of treating HIV patients. He says there's great support for the administration's AIDS-fighting plan, even though the details may not be that different from programs already underway.
It's a reaffirmation by the Obama administration of the commitment to see these goals forward and increase the number of access of people to effective HIV care.
While the stigma of AIDS persists, Horberg says it's not the death sentence it was when he began practicing medicine in the 80s.
The average life expectancy once diagnosed was 6 to 8 months. Now we're saying with effective treatment, effective collaboration with your clinician and healthcare system, you could live a normal life.
Pam Coulter, CBS News, Washington.